So certainly this is something that's on every parent's mind, on every young athlete's mind, and certainly can be very concerning. I will say though that these are fairly rare. So we think that sudden cardiac death, which means an acute rhythm change of the heart in a young person, an athlete, happens probably in 1 in 100,000 or 200,000 individuals, which means that across the country, if you look at participation in sports, a sudden cardiac event is going to occur 300 plus times in our country. Again, as I said, we'll read about it in our local news because it's that big of a deal. If you compare that to sudden cardiac arrest in older people that have had heart issues, that's over 350,000. So that's 747s a day, every single day. That's how many people are dying of sudden cardiac arrest. So when it occurs with sports, it catches all of our attention because these individuals are the epitome of fitness, right? We think about, particularly at the professional level, these athletes are well trained and well conditioned, and so it's certainly very scary when we see something like this happen. So first off, I'll say that we think that he had obviously the sudden cardiac arrest. That's all information that will come out over the next few days and weeks. It certainly looked like it watching the game and watching that happen in real time. What happens when you have a cardiac arrest or a sudden a sudden rhythm change of your heart. So you're in a normal heart rhythm, and then suddenly you're in an abnormal rhythm that's not able to maintain circulation. The rhythm doesn't produce enough of a squeeze of the heart to allow you to send blood to the brain and the body and everywhere it needs to go. So this is typically called ventricular tachycardia or ventricular fibrillation. Fibrillation, it's kind of like the word says, the heart is quivering as opposed to beating normally. So if that heart is quivering, it's not generating blood flow to all the places that it needs to go. So clearly, he was down, he jumped back up, and then something acutely happened, and obviously he passed out, and then the resuscitation started from there. So